digital health realm. Leading the discussion is Kumar KV, the Chief Information Officer of Narayana Health. He is here to share invaluable insights and cutting-edge strategies to keep our information secure. So without further ado, let's give a warm round of applause to Mr. Kumar KV.
So this is the most difficult session. I've been given the task of keeping people awake. Even I'm feeling sleepy, so it's siesta time now. We'll wait for some more time or we start? Fantastic. So I think I'm not going to bore you with jargons. I'm not going to talk in depth cybersecurity architecture and all the technicalities involved. But I would tell you what's troubling healthcare, right? And what's troubling digital healthcare and why is it very, very important to safeguard ourselves? Why is it important for us to be resilient and to an extent I would say anti-fragile, right? So we have to learn from our mistakes and ensure that we beef up our practices to ensure that we are able to bounce back our operations in a much faster manner. Because we all know that we are in the business of saving lives. We are in life critical operations and it is very essential to ensure that there is no sort of breakdown when it comes to clinical operations. The margin of error is not even there. There is no, we can't even have even less than 1% also, right? There is absolutely no margin of error, right? So with that context, I'm going to talk about today a very, very important topic on the role of information security in healthcare. In from today morning, we talked about innovation, we talked about next practice, we talked about investment, we talked about regulatory and compliance, and one of the gentlemen said that regulatory and compliance is the essence. Then we had, the panelists basically delving deep about, their view of digital health and all that. I think as especially after COVID and especially after healthcare providers have absorbed so much of digital health technologies, and as more and more digital health technologies basically are absorbed by these enterprises, the core part of the problem is how do you handle security and privacy for each of these? Because today healthcare providers have actually assembled multiple toys that are actually there and trying to make them speak, but have they done it right? Have they ensured that there is security and privacy by design? And these are some of the things that we should always ask for. So in today's discussion, what I would do is I'll just take you through some of the snippets of what is my view on the the role of information security from a healthcare standpoint. What are some of the best practices? How should we basically look through this, and why is it basically important? So just to give a sense of the landscape, I know this picture can be very overwhelming, but then this basically gives you the complete landscape or what we deal day in and day out when it comes to healthcare technology, right? Let's go from left to right? So, so if you see, there are, any healthcare provider may be spread across India, there might be overseas locations, they will have facilities, they will have specialties, associates, they will have colleges. Many of the large healthcare chains have nursing colleges, they will have a dedicated clinical research team. We deal with a ton of systems over here. Everything basically plays a specific part, a specific role in clinical operations. So be it the health information management system, be it the doctor app, be it the patient app, be it the ERP platform. And then we have a set of people whom we share data, right? We have doctors, nursing, paramedical who pump in data and also consume data. Now, it is very important, all these systems basically work with one another and pass a ton of data. But have we ever thought about the data that we basically deal in, right? We collect data in multiple, at registration desk we basically collect data, at sample collection we might collect data, at billing counters we collect data, the nurse basically collects EHR data. At various points of from a care journey standpoint, data gets collected, data gets processed, data gets analyzed, data gets tracked. So we have we have registrations, billing, TPA, all these are basically the points at which data is actually collected. And what do we collect? Today we collect patient identifiable information, or we call it sensitive personal information, right? It is sensitive, and it is basically a health data, which one's own personal data, right? So we basically collect the entire history, allergies, present illness and all that stuff, demographic information, identifier health records. So all these data have been classified by the data protection law as critical information. We have to remember that healthcare and finance or the BFSI sector are classified as critical sectors, which means that whatever data that we basically collect or process falls under the critical information categories, which means that as a data fiduciary, we have more responsibility, right, or more care has to be exhibited, or controls have to be put in compared to any other industry that is actually out there. And it is all about how do we then process the data, how do we then share the data, how do we then enrich the data, derive insights, right? So it is very important that the data that we actually collect, the systems that actually play a role, we basically collect sensitive information. We are the guardians of data, which means that appropriate cyber security measures and privacy measures should be baked in at each and every stage of the process that is actually there, right? Cyber security is not an afterthought. It's not just it's not going to end with just a username and a password that is actually there, but then every bit of practice or control has to be baked into the process. Now, this basically gives a very good view of incidents and breaches, right? So friends, we actually know, there can be many incidents, but have all those incidents basically get converted to breaches? This is basically from the Verizon data breach information report. This is 2022, yeah, the latest one was released recently. But then it gives a sense of about the uptick in the number of incidents that are actually there. If you see the denial of service attacks, right, so let's say you have a digital portal or a digital health portal, the hackers basically flooding these portals with so much of broadcast messages and basically denying service, right? So you see these many incidents that have actually risen over a period of time. If you see the denial of service, the basic web application attacks, and the breaches that have actually, which means that incident is basically somebody coming and knocking your door. Breach is somebody breaking your door and getting into your home. That is a breach. So in cybersecurity, we always see how many incidents have resulted in breaches, because breach is what will then lead on to further problems, which means that we have to activate our incident response plan. We have to basically notify the people who have been breached, right, or the data has been breached, right? So this is very important. So, and hackers are getting sophisticated by the day, right? Every single day we receive close to 25 to 30 advisories, and this year the digital health applications, or in any application you have so many vulnerabilities that are actually there. Hackers have basically exploited these vulnerabilities and ensured that they are able to breach into the system. Look at the SolarWinds attacks, look at the Equifax attack. So it can start from as simple as a phishing attack, and it might lead all the way to a breach where they exfiltrate your data, basically sell the data in the dark web. So we talked about what makes it special. Today, if the demographic data of an ordinary citizen costs $1, healthcare data is basically valued at around $400 USD in the dark web, right? That is the value of the data. And imagine 100,000 patient data that is actually there. Just multiply it, right? And let us say in a country, in a $1 billion population, or in a billion company, or I would say a billion citizens in the country, imagine the number of records that we actually have, and this will have a multiplier effect. It is specific to an individual and ensuring that the right information. So in cyber security, we always have these three triads, right? Confidentiality, integrity, and availability. The integrity of the data is actually paramount from a healthcare standpoint, right? Cyber security and availability is also even important. But then you want to ensure that the right data is actually presented every single time. It can't be 0.01 less or 0.01 more. It has to be the right data that has to be presented to the respective persona. So preserving integrity is very vital, and disclosure of data, right? You have multiple stakeholders. You have a nurse, you have a paramedic. Even in nurse, we have a ward nurse, an ITU nurse, an OT nurse. You have an intensivist, you have a paramedic, you have a doctor, you have a surgeon. So each of them would require access at various levels, right? So ensuring that the disclosure is there is segregation of duties that is actually there, which is present at each level, so that the need to know basis, or they need to see the data only which they need to see, and nothing more, nothing less, right? And breach of health information, imagine if all these health information data basically gets aggregated to a national exchange or something like that, and if that gets basically reached, the entire country's health information data basically gets breached, right? Recently also there were multiple news outlets basically talking about leak of data of sensitive which are sensitive in nature. What are some of the information jewels we have? As I talked before, it is demographic data, diagnosis, allergies, history of present illness, medical images, sexual orientation, financial status. All these basically come under the purview of the digital data protection bill that is actually there, which is being passed for privacy, right? While the rules are yet to be framed, we understand that the rules basically will have much stricter guidelines, because healthcare will come under heavy regulation from a privacy standpoint. And who are the interested parties, and why are these people interested, right? Imagine if there is a politician, right? And if that politician's medical record, and he has certain allergies or he has certain disease, right? Now hackers can basically take that data and then understand that and then plan ways to assassinate this person too, right? That is what is the next criminal activity. It's not about going and stealing gold or silver from a house. I think I think even thieves have become so sophisticated that they are able to socially engineer, get into the systems. If you have very important people, they basically take out these medical data and then structure ways to to harm them. So the interested parties are pharmacies, we have payers, facilities, courts. So all the healthcare data is basically dispersed across these multiple facilities that are actually there. And there are advanced persistent threats or nation state actors, which basically, let's say if you take a China or a North Korea, and there is a periodic table, like how we used to learn chemistry and we had all these elements basically laid out. We have a periodic table for advanced persistent threats. They call it the Lazarus group, the crazy bear, stone panda, and a lot of other stuff, right? Very, very fancy names. There is something called as I think Smoky Kitten or something like that, right? So very nice names, but they have a good periodic table. Each of them belong to a nation. Each of them basically are even part of a certain country's intelligence service, and they have very clear goals, whether they will hit low profile or high profile people, or they have very clear objectives that are actually there. And there are various steps in basically right from getting in, exploitation, reconnaissance, and basically lateral movement, right? So these are some of the steps that hackers basically follow. So in healthcare, it is extremely important that we exchange a ton of data across multiple systems. So at each and every step, we have to ensure that the right controls are basically put in. Now, imagine a ransomware attack basically happens in a hospital, right? The first people that be affected is our patients. And then our clinicians too, right? They will not be able to provide the care to them, right? If systems basically go off. So it is extremely important for enterprises to have a cycle of emergency or understanding how to respond, right? And every enterprise should have what is called as an IR plan. It's called as incident response plan or incident response plan. And you need to ensure that you onboard seasoned experts to basically deal with the cyber crisis. Now, I will not go into the details, but then the steps are very clearly laid out, right? You do stress assessment, deliberate planning, you prepare for that, and when the impact comes, it is very important that we keep ourselves prepared, which means that drills, you have to do a number of mock drills, you have to do tabletop tests, you have to work with your executive management, make them aware about the current state challenges that are actually there, and then prepare for that day when any enterprise can actually get hit, and when your enterprise will basically get hit. But then when you are actually hit, how fast you are able to recover from that. That is very important. Being resilient, the ability to bounce back at a shorter time is what healthcare providers should be focused on. It's not about buying all these costly toys and basically assembling all these security toys and assembling, but then whether those toys have been effective to enable you to bounce back into normal operations so that patient care is not affected, and that should be our single motto. Now, there is a lot of detail in that, how do you approach risk management, but then there are various towers, right? You look at your governance, right? Governance is all about policies, procedures, and running and setting the, setting the stage for how do you basically govern that entire function, be it security or privacy. One of the common mistakes that we actually do from an enterprise standpoint is we cut and we basically say, hey, arey, tere paas policy hai kya? Can you basically give me your policy? Don't copy paste policies. Your security posture might be very different from other companies' security posture, right? So let us not do copy paste of policies, procedures, and standards. Write your own, standards that are actually there, or reach out to ISO company, or let us say organizations like ISO who basically can give you templates. Risk management, very important. You have two types of risk. I don't know how many enterprise do this, but then there is enterprise risk, then there is information risk. Information risk is a subset of the enterprise risk. Map out your enterprise risks that are actually there, map out your information risk, do a risk assessment, and then follow through the buckets of avoid, accept, mitigate, and transfer. Very, very simple terminology. Either avoid the risk or accept the risk or mitigate or transfer the risk. Understand what your organization's risk appetite is. These are all terms which you need to speak up to your executive management and ask them these questions. What is our risk appetite? Which means that if what defines a loss, like 100 crore defines a loss, or 200 crores, let us say if cybersecurity attack happens, right? Do we basically say that, okay, we can, if we basically don't have systems and if we lose 100 crores, is that okay, right? So I think we will have to look at the risk management from that perspective. Have strong cyber insurance also for your company based on what your weekly revenue or weekly 98th percentile of your weekly revenue or your 15-day revenue is. Program development, have resources, ask for proper budgets using a business case. Architecture driven approach, just because I like that toy, I cannot buy it, but it should be architecture driven. Have incident response, study the incidents, study the breaches, keep yourself updated, prepare for the worst, right? There is something called a SITMAN, it's situation management process with command center. Do a lot of drills which will help you make you resilient and anti-fragile. And by design approach, any initiative that we do across our thing, we basically take a patient app, we basically take a mobile, we basically even subscribe to a kiosk service. Ask the question, what sort of security controls have you put in place? It is very important to ask that question, right? So security and privacy by design, right from the stage of feasibility, not in design, not in development, not during implementation, but right at the stage of feasibility. Thank you. I hope I have provided you sufficient information, but then this is a very, very bad world out there, and it is very important to safeguard ourselves and our enterprises. So stay safe, stay happy. Thank you.
Thank you for the presentation on the importance of resilience in the face of cybersecurity threats. Your emphasis on the ability of healthcare institution to both bounce back after an attack is both crucial and timely. So thank you so much.